Thanks, Ellen. Great to be here today. And I'm closing off this section on rehabilitation sciences and building on what Kathy and Susan have already told you. I'm going to talk a little bit about speech-language pathology. So our program was established in 1958. Next year is our 60th anniversary. We're very excited about that. We became a master's degree program in 1980, and we're the largest speech-language pathology program in Canada. We also have an MSc and PhD research streams that we started in 1995, and those are currently run through the Rehabilitation Sciences Institute. But today I'm going to talk about that Master of Health Science, our clinical program. This is our website, so I'm just going to direct you there for a lot of information and more specifics that you can go to. But first of all, who are speech-language pathologists? We're a newer profession and certainly an interdisciplinary one. We're autonomous professionals, and we deal with both typical development and atypical or disordered communication and swallowing, both communication and swallowing. 10% of the Canadian population has a communication disorder. And our roles include those of clinicians, but we can also be professors, managers, administrators, researchers. And as Kathy and Susan have already indicated, really these can be very rewarding careers and lots of opportunities for flexibility and moving amongst different roles within the profession. Areas that we work with include speech sound production or articulation, sometimes with young children, most commonly in preschool or in schools. Resonance, individuals that might have had cleft lip and/or palate have resonance issues. People with voice problems, we work with professional singers, or children who have vocal abuse and very voice problems. Fluency or stuttering. Many of you might have seen the movie The King's Speech that won the Academy Award a few years ago, talked about the early development of our profession in fluency. Pre-linguistic communication with young children. Before they're saying anything, we look at their cognitive abilities. We look at language comprehension, understanding, and talking skills with children and also with adults who might have had strokes and have aphasia. We work on pre-literacy. This isn't a well-kept secret, I think, that speech-language pathologists work a lot with teachers in the schools on pre-literacy and literacy skills. Cognitive communication, individuals who might have had concussion or have traumatic brain injury or might have some dementia, we work with them as well. Social or pragmatic communication, we want to make sure that the individual can use the communication they have to make their needs and wants known. Feeding and swallowing is a large part of what we do, particularly in acute care hospitals. A speech-language pathologist in that setting, 95% of the caseload would focus on swallowing. We also deal with individuals who need alternative and augmentative communication systems, computerized systems to help them talk, for example, like Stephen Hawking. And our students do a minor in audiology, so we also work on oral rehabilitation with our students and sometimes with our patients and clients, and sometimes accent modification too. But we're looking at the impact that communication swallowing disorders has on everyday life. So in terms of where you would work independently or as part of an interprofessional team in a huge host of sites. A lot of our graduates, about a third, end up getting jobs in school boards, but you can work in nursing homes, early intervention programs, private practices, research centers, etc. Our program is 22 months. It's a modular program. We have 5 academic units and then 4 clinical units or 4 clinical placements. We follow each academic unit by a clinical placement in that area. So you're immediately applying the academic work that you've learned into a clinical situation. We also have a capstone exercise and electronic portfolio so that you can demonstrate that you've met our 8 curriculum objectives. Some innovative features of the program: in each academic unit, we have an integrative learning experience. So all the professors need to get together in an academic unit and come up with a case, something practical to integrate that material. So that really integrates the academic and the clinical information. And in our clinical placements, we're sending students out to school boards and hospitals and treatment centers, both within the GTA and internationally. But we have teaching clinics that the students come back for. So we want to make sure there's a real quality to the experience that they're having. And we do small group and large group work on those days. We really feel we have an evidence-informed practice focus. We have the capstone portfolio, as I've already said. And we have an interprofessional education curriculum. And Susan touched on that, but I'm just going to highlight that in this IPE curriculum, you learn about other professions, from other professions, and with other students to develop competencies in values and ethics, communication, and collaboration so that you're ready once you leave our programs to hit the ground running and collaborate with others in the real world. And this has been found to really increase your satisfaction as an employee and to maintain your ability to work somewhere longer. These are the professions. There are 11 health science professions at the University of Toronto that participate in the IPE curriculum. OT, PT, and SLP are 3 of them. Also, we have internationally recognized groundbreaking research conducted by our faculty in all of the areas that I've mentioned. And we have a close relationship with our speech-language pathologists in the community where we place our students for placements. And we have a very strong and supportive Alumni Association, which really helps the students. They promote different educational events and social ones. So looking at admission to our program, as Kathy's already said, the admission time window is exactly the same. Early January, you apply for September admissions. We're a slightly smaller program. We're looking to take about 60 students in 2018, and as with the other programs, it's highly competitive. So our requirements, we need a 4-year undergraduate degree, and as Susan was saying, we accept graduates with any type of undergraduate degree. We've had students who have a drama major or philosophy major, linguistics is very common, or psychology. So again, we're interested in that diversity, and we think that that enhances our program. But we do have 6 prerequisites, so we want to make sure when students enter the program that there's some commonality that they can springboard from to ensure success in the program. So the 6 are here, and that includes phonetics. And on our departmental website, we have for each university what are the appropriate courses in each of these areas. We also required 2 academic letters of reference from someone who knows you well, and a clinical letter of reference from someone who's supervised you during a volunteer experience. And I'm going to talk about that in a moment. And also a 1-page letter of intent about why you want to come into speech-language pathology. So the volunteer experience, we're asking that you get 14 hours with a speech-language pathologist who's licensed or certified, and it can be in a variety of settings, but we want to make sure that you understand and know what speech-language pathologists do, and they're ones that are going to write a letter of reference for you as well. So that's my basic overview, and I'll look forward to chatting with you later. I have a student, Miranda, coming as well, and so she'll be able to answer questions, and that's the email of our admissions person, Sarah. Thanks very much.